So Dr. Begovic, let's talk about labiaplasty and who is a candidate.
Sure. So labiaplasty involves shaping and trimming the labia minora and sometimes the labia majora. And the surgery itself is performed under general anesthesia. I personally feel that for patient comfort, it's the most appropriate anesthesia for this procedure. And essentially, after the labia are shaped, multiple layers of dissolvable sutures are placed in order to allow the new edge to heal. Most people feel like this surgery, is going to be extremely painful or really uncomfortable with a long recovery. However, I would say on average, most of my patients are pleasantly surprised by how quickly they recover from this procedure. I always tell them that the labia tissue is very similar to the tissue inside your mouth, and if you've ever sort of gotten a cut in your mouth or bitten your tongue, you see how quickly that heals. It's very vascular. So actually the healing process is not usually as arduous as most people think it might be.
Dr. Begovic, what is the actual cause for a need for labiaplasty? Is it childbirth, or are there other reasons why a patient may need this procedure?
Sure. I mean, childbirth is a very common cause just because sometimes there are injuries or tears that occur with childbirth, and just the hormone fluctuations sometimes cause the labia minora to elongate or look a little bit different or have some hyperpigmentation that a lot of times women don't like. However, there are a lot of young patients that are just born with asymmetry. I've had a lot of students recently who've come in, I mean, they're in college, that have never had children before, but one labia was maybe 2 or 3 times longer than the other. Sometimes patients don't like the shape, so it's for purely cosmetic reasons. But a lot of times the excess labia minora, it rubs on patients' clothing, so in jeans they feel pain, discomfort, or in leggings and workout clothing they feel like they see a bulge. So there's a variety of reasons why women get this done, and they're all very good reasons.